And thank you for joining the webinar today. My name is Shanna Clark. I'm the Vice President of Sales and Operations with Medicare Advantage Specialist and MAS Insurance and Marketing. We're very excited about 2016 and all the opportunities associated with this year. Some of you who work in the MA market just ended the annual election period, and you're letting out a big sigh of relief that it's over. We send a big thank you for all of your efforts this season, but today we'd like to present you with a few things to think about as we get going in 2016. So before we get started, if you're attending the webinar, can we just make sure that everybody has their phones muted? There we go. Thank you. Before we get started, if you're attending a webinar for the first time today, I'd like to introduce you to MAS. We are a nationally recognized award-winning field marketing organization and a leader in the insurance brokerage industry. Our office is located in beautiful Hoover, Alabama, just outside of Birmingham. Today and over the next several weeks, we're kicking off our Making Sense of the Medicare Market series of webinars. I hope you'll mark your calendars for the following events. These sessions will be jam-packed, full of information and marketing tools guaranteed to boost your income. Our goal is to help you with ideas and tools to think outside the box, but truthfully, we just want you to realize that there is no box. Before we get started, I'd like to introduce the webinar control panel on the right-hand side of your screen. There is a chat toolbar which allows you to ask questions, and we'll monitor those throughout the presentation and then share with the group at the end of the webinar some of those questions with some answers. Webinar technology is great, but sometimes there's minor issues that occur. So if for some reason the audio pauses or the screen moves a little slow, just stick with us and the technology issues will work themselves out. So let's get started with today's webinar, learning more about selling during the SEP and special needs plans. I'm pleased to introduce one of MAS's marketing directors, Matthew Klamer. Matt is going to be sharing this presentation with you today. So Matt, I'm going to hand it off over to you.
Thank you, Shanna, and good morning, everyone. Thank you for taking time out of your busy schedules today to attend today's webinar. 2016 is here. Let's make the most of it by making sense of selling to the Medicare market. And like Shanna said, understanding that we don't need to think outside the box because there is no box. My name is Matthew Klamer. I am a marketing manager here at Medicare Advantage Specialist. We have some great opportunities in the life and health markets with a lot of information to share with you today. So with that said, let's get started. First, we're going to talk about Medicare Advantage Specialist, who we are, how we can help you grow your business. Next, we'll briefly speak about becoming a portfolio-minded agent. Then we're going to move on to selling during the special election period, understanding and marketing chronic and dual special needs plans. We're going to go over the various election periods available in the special election period and ways to market to the SNP population, followed by discussion on referrals, lead programs, as well as other programs and incentives that Medicare Advantage Specialist offers. And last but most certainly not least, why you should partner together with Medicare Advantage Specialists. So without any further delays, let's get going. So with it being a new year, you may be sitting around thinking how you're going to increase your sales this year. How can you expand your portfolio? How are you going to get leads, and will you have the money to afford those leads? Some of you might even be asking, what exactly is my niche market? You might not have figured that out quite yet. And then how in the world am I going to get training I need to execute my plan? So we've put ourselves in your shoes, asked the same questions. How can we help our agents be successful in this market? What can we do to offer you more support and guidance? And we decided that reflection is a pretty good place to start. With that being said, in order for you to put a plan in place, you have to know where you are right now. As Steve Jobs once put it, you can't connect the dots looking forward. You can only connect them looking backwards. So looking back at 2015, how was your year? Did you meet your sales goals? Did you write all the business you wanted to write, or could it have been a better year for you? Take some time to reflect if you haven't already. What are your strengths? Know your strengths and maximize on them. What are your weaknesses? Because we all have them. Let's be honest. What could you improve on personally and professionally that could help your business grow, that could help you grow? Looking back, are there any opportunities you might have missed, maybe because you weren't prepared? And it's true, the deeper you look, the more answers you're going to find to get you where you want to be. So what is the big picture questions you should be asking yourself? Let's get started with, how much did you make last year? Did you make enough money? Would you like to make more? Has your business increased, or has it slowed down a little? Was your source of revenue from new business, or did it mainly come from renewals? I personally hope both. What did you write the most of last year? Did you focus primarily on Medicare Advantage, or was it maybe Medicare supplements? Maybe you're a final expense agent or work with indemnity products only. Do you know your closing rate when offering these products? And is that business staying on the books? Persistency rating is a big deal. None of this is necessarily exciting to look at, but I know, it's not fun, but it is crucial to know these aspects of your business. So now that you know where your business is, let's plan on where you want to see your business grow. So while thinking about that, why not create a compelling future by maximizing your strengths and maybe compensating for any weaknesses? We all have the capacity for growth, and all while leveraging the opportunities available to us. One of these opportunities that is presented to you today is putting more focus on becoming a portfolio-minded agent. Learning the Medicare market, including Medicare Advantage, Medicare supplements, or both. Indemnity and ancillary products like cancer policies, critical illness, and hospital indemnity plans, or by offering life insurance, such as final expense policies, because by increasing the number of products you offer, you can guarantee an increase in sales as well as client retention. Which brings us to our next slide. We can all become so focused on creating new business with new clients, and yes, new business is easy to measure, but maybe sometimes we forget that customer retention can be even more cost effective. As you can see, studies show that $1 paid towards customer retention increases profits by more than every $5 spent on acquiring new customers. So you're probably asking, well, how am I supposed to increase customer retention? One of the best ways is simply to sell more than one policy to your existing clients. It doesn't have to be at the same appointment, but make sure before you leave your client's home that they're aware that you offer more than just final expense or Medicare supplements or Medicare Advantage or whatever it may be. The second very proven method is just simply staying in touch. Make sure your clients are getting a birthday card or a phone call from you every year, or even just take note in the mail letting them know that you appreciate their business. When is the last time you received a handwritten note just simply saying thank you? This will, of course, help increase their customer loyalty as well. If they need other products or have questions, they're going to call you. A little bit more about increasing the products you sell. So what we're showing is a basic model here of how you could earn $75,000 income, which is a very realistic median number for you as an insurance agent in this industry. So you can do that by selling one product, earning an average of $250 per sale to 300 clients a year. But now, instead of just offering one product, what if we offer two products, earning $500 per sale, but only having to sell to 150 prospects per year? That would also put you at earning $75,000 in commissions. When we take it a step further and now offer four products to our clients and earning an average of $1,000 per sale, we have then reduced the number of clients to sell every year to only 75. As you can tell, earning the same as if you were to sell 300 clients throughout the year. So what have you done here? You've dramatically reduced the number of people you have to get in front of and in turn sell, while increasing the persistency, earning more referrals, and achieving a higher close rate because you have built a relationship with your client. This will take less effort on your part and will produce a much more fluid sales cycle. All right, your clients really do want to buy from you. 78% of shoppers who have a previous relationship with their agent bought an additional insurance policy when their agent simply presented it to them. You are their go-to person. You are doing your clients and yourself a disservice if you're not offering products that help fit their needs. They know you and they trust you. They've already bought one product from you. Over the next couple of weeks, we're going to really dive into these topics. Let's get to the meat of today's presentation. We want to spend some time talking about year-round selling opportunities. Medicare Advantage is where our focus will be spent today. We're going to discuss the opportunities available in the special needs plan market, help you understand low-income subsidy, how to create a SEP for a client. We'll even go over election periods and talk briefly about chronic and dual plans. We aren't going to talk about MedSup today, hospital indemnity and critical illness, but these products do offer year-round selling opportunities as well, so don't forget about those products. We will talk about this more in the coming weeks on the other webinars we have scheduled. While a number of agents only market Medicare Advantage during the AEP, our statistics show that 50% of our year sales come from the SEP. There is no reason to stop selling once AEP ends because the opportunity is exponential. With the growing number of people who are turning 65 every day, along with the population who qualify for a special election period, selling during the SEP is a no-brainer. As you can see, the turning 65 population has steadily increased over the past 15 years. By the year 2050, the turning 65 number is projected to be over 88 million. The number and opportunity is huge with the T65 market. Although the AEP for 2015 plans ended on December 7th, beneficiaries may qualify for special election periods throughout the year, during which they can change their plan coverage. A special election period, also known as an SEP, is a set time period during which Medicare recipients can change their plan or return to original Medicare. Reasons for the change of the plan may include, but are not limited to, getting assistance from the state through limited income subsidies, also known as LIS or Medicaid, having a qualifying chronic condition, diabetes, cardiovascular disorders, chronic heart failure, and chronic lung disorders. If you move, changes where you live, changing your residence, you lost your current coverage, changes in your plan's contract with Medicare. Other special conditions are included. Special election periods are available only to beneficiaries who meet certain criteria that allow them to make an election outside the traditional enrollment periods. An individual's eligibility for a SEP does not convey eligibility to enroll in the plan. In addition to having a valid enrollment period, an individual must meet all applicable MA eligibility criteria. It is our responsibility as the agents to determine whether or not a beneficiary is eligible for a special election period. Here are several other election periods that can be used during the special election period selling season. IEP, initial enrollment period. This is your turning 65. If someone's aging into Medicare, the IEP begins 3 months prior to their turning 65 birth date and lasts for a total of 7 months. So you get 3 months prior, the month of, and 3 months after. SEP, loss of SNP status. Customer was enrolled in a special needs plan but lost their special needs qualification required to be on said plan. There again, the change in residence. Customer has recently moved outside the service area for their current plan, or the consumer recently moved and this plan is a new option for them. There's also a special election for loss of employer group coverage. Consumer is leaving their employer or union coverage, grants them a special election period. There's also one for termination non-renewal if the consumer's plan is no longer offered for their area. And then again, contract non-renewal. The consumer's plan is ending its contract with Medicare, or Medicare is ending its contract with said plan. Here are the specific special election periods you'll see used in the special needs plan market. The special election for dual eligible, consumer has both Medicare and Medicaid. If their state helps pay for any of their Medicare premiums, they are dual eligible, full or partial. You have your special election period for dual eligible status loss. Consumer no longer qualifies for Medicaid, or their state no longer helps pay for their Medicare premiums. They are granted a special election period to change plans. SCP for your special needs or chronic. These are your individuals with a qualifying chronic condition. And then, of course, your LIS, non-Medicaid maintaining LIS. If someone has help paying their Medicare prescription drug costs, this applies to Part D plans only. You also have an LIS loss of status. If someone has LIS and is losing that LIS status, they are granted a special election period, and again, applies to Part D plans only. So here's the landscape of the special needs plan available across the country. We have approximately 10 million dual eligibles nationwide. 1 in 5 beneficiaries qualify for Medicaid, and over 21 million beneficiaries have at least 2 or more chronic conditions. There's a lot of opportunity for you out there. I know this map does not list out the carriers, but if you want additional information on what carriers are available in your area, please contact our office. What is a special needs plan? A special needs plan is a type of Medicare Advantage plan that combines all benefits of original Medicare Parts A and B, along with prescription drug coverage, Part D, but are only available to beneficiaries who may have a specific health condition, be eligible for both Medicare and Medicaid, and or be a resident of a long-term care facility. Here's a sampling of a few carriers we partner with who offer special needs plans. For specific plan details and where these plans are available, as I said, contact one of our marketing managers. To be eligible for a special needs plan, beneficiaries must have both Medicare A and B, but also must meet the specific conditions of the special needs plan itself. There are 2 types of special needs plans available in today's market. You have your dual special needs plans that are available to individuals on Medicare and Medicaid, and then of course your chronic special needs plans. Your special needs plans provide personalized guidance and resources to help members get the right care and information based on their specific condition or needs. Plans also have a $0 or low monthly plan premium. Depending on the specific plan, benefits may also include routine dental, vision, hearing, non-emergency transportation to and from medical care, fitness memberships, over-the-counter allowance, and much more. So now we're going to go over the chronic special needs plans. These enrollments are restricted to special needs individuals with specific or disabling chronic conditions. For example, diabetes or a heart condition. These plans were designed to allow more focus on monitoring and managing the health of these individuals and lowering their hospitalizations that could have possibly been prevented. Just as you can see on the screen, your client can be eligible for this plan if they have a chronic condition and are not already enrolled in a chronic special needs plan. They are allowed only 1 special election period in their lifetime, and their SCP starts upon qualification of the disabling condition and then ends when enrolled into the plan. Dual eligible special needs plans enroll beneficiaries who have both Medicare and medical assistance from the state plan under Medicaid. These offer the opportunity of enhanced benefits by combining those available through Medicare and Medicaid. They're also only allowed 1 election period, but their election period is continuous as long as your client is Medicaid eligible, and their effective date will also be the first day of the month following receipt of the election. Special needs plans offer a variety of ancillary benefits as well. As mentioned before, transportation. Educate members about how the transportation benefit works. It covers routine transportation to medical appointments, pharmacy visits, and ongoing care such as dialysis. There's a nurse line to help consumers find resources such as immediate 24/7 answers to their health questions from experienced registered nurses. Podiatry care. Educate consumers on the benefits of routine foot care and what the health plan covers through enrollment in a UHC DSNP Medicare Advantage plan. Silver sneakers. Help consumers find participating Silver sneakers locations near them with facility directories and sales flyers. They also have hearing benefits. It provides customers care through a national network of providers and, if needed, allows consumers to purchase brand name hearing aids at substantial savings. They have a health products catalog on the ordering and delivery process for many everyday items such as lotions and vitamins. They also have dental, preventative dental, $0 copay for routine dental services. Also includes checkups every 6 months, cleaning every 6 months, routine complete x-rays once every 3 years. There's also an eyewear credit for contacts or lenses and frames. So many ancillary benefits that are included in your special needs plans that can be very valuable to your members. You may be asking yourself, why do I want to work in the low-income market? Well, there's a tremendous opportunity with approximately 10 million dual eligibles nationwide. Only 35% of Medicare beneficiaries live at or below 150% of the federal poverty level. 1 in 5 Medicare beneficiaries qualify for Medicaid. A lot of them don't know that. The average Medicare beneficiary spends 34% of their income on health care. They have continuous enrollment periods. That's one of the big selling points. You enroll them year-round, continuous enrollment periods. There's an opportunity to provide your knowledge and assistance to a population who need help. When working in the low-income market, there are a few factors you do need to be aware of. There are programs designed for people who are low income. The first is the Medicare Savings Program. Medicare Savings Programs are programs that will pay for low-income individuals Medicare Part B premium, $121.80 a month for the year 2016. Medicare savings plans are available in every state. They are federally funded but administered by each state's Medicaid agency. There are 3 kinds of Medicare savings program. You have your qualified Medicare beneficiary, that's full-blown dual eligible, also known as a QMB. Specified low-income Medicare beneficiary, also known as a SLMB, that helps pay the Part B premium. You also have a qualifying individual, QI1, also helps pay the Medicare Part B premium. And then if your client qualifies for a QMB, SLMB, or QI1 program, they automatically qualify to get extra help paying for their Medicare prescription drug coverage as well. 3 kinds of Medicare savings programs, also known as Medicaid, as we mentioned, the QMB. Any individual making less than $1,001 per month. If you have a couple, there's the amount. If they make less than $1,348 a month, they are full dual eligible. Then you have your SLMB. The amount's a little bit more, less than $1,197 a month. They qualified for the SLMB classification. If it's a couple making less than $1,613 a month, they qualify for the SLMB. As I said, the SLMB does pay the Medicare Part B premium, so you would be eliminating the $121.80 per month they would have to pay. As you can see, the qualification for QI1 is a little bit more attainable. Individual making less than $1,345 a month qualifies for that QI1 assistance in paying their Part B premium. Now let's take a look at how you can expand your prospect pool by identifying people who may qualify for a low-income subsidy, otherwise known as LIS, or extra help. The federal government provides an extensive program for people needing financial assistance with Medicare Part D program. Qualification depends on income and available financial resources. Medicare will provide extra help that may cover 85% to 100% of prescription costs and may also pay a part of all Medicare Part D premiums. The amount of LIS extra help a beneficiary receives depends on their income and resources. Beneficiaries will receive either a full subsidy or partial subsidy, so be sure to review the LIS extra help chart for details. Most people who qualify for extra help will pay absolutely no premiums, no deductibles. In 2016, costs are no more than $2.95 for each generic and $7.40 for each brand name drug covered. Some people get LIS or extra help automatically. These include people who are enrolled in both Medicaid and Medicare, often called a dual eligible. Those receiving supplemental security income, SSI, and those who qualify for a Medicare savings program. These individuals do not need to apply for the program. They may still wish to consult a benefits counselor to determine the best Part D plan to suit their situation. However, it's not required. Anyone else who is not already enrolled in the benefits noted above must apply to Social Security to receive LIS or extra help. Now you know the benefits to a client who qualifies for LIS, but what does that mean for you? It means that you can help create a special election period for your client so they can join a Medicare Part D drug plan at any time of the year, which also includes a Medicare Advantage prescription drug plan, also known as the MAPD. People who get LIS extra help do not need to wait for the annual open enrollment period, October 15th through December 7th, the AEP, to change their plans. Any plan changes will become valid for the following month. So this is especially helpful to seniors, adults with disabilities who may need to begin medications that are not on their current plan's formulary or approved drug list. There is no Part D late enrollment penalty. Even if the beneficiary enrolls late, that is after they were first eligible to join a Part D plan, and if they did not have any other drug coverage. So no late Part D enrollment penalty. If you know a senior or adult living with a disability who may be eligible for LIS, direct them to the following. Benefits Checkup has a direct link to submit LIS applications to the Social Security Administration. In addition, the free online screening tool will tell applicants if they likely appear eligible for the other benefits that they can help with health care and prescription costs. Their local state health insurance assistance program, also known as SHIP, are federally funded to provide free objective assistance to people with Medicare and their families. SHIPs can also help with applications for LIS and the Medicare savings programs. To find your local state health insurance assistance program, call toll-free at 877-839-2675 or visit the SHIP TA Center website. People with Medicare can also apply directly through their Social Security Administration. To qualify for LIS in 2016, income levels must be below $17,655 per year for a single person, or a couple, $23,895 living together is the income level. If they make below those amounts, they qualify for LIS as long as their assets are below the $13,640 for an individual and the $27,250 for a married couple. Let's get to the meat of today's presentation. We want to spend some time talking about year-round selling opportunities. Medicare Advantage is where our focus will be spent today. I'm sorry, this is a repeat of a earlier slide. Here are several ways to market to your SNP population. Grassroots efforts are one of the leading ways to generate business. Get involved in your community. Go to your local YMCAs and community centers. Churches and or food banks are great ways to generate business. Provider networking is a great way to generate business. Talk to your dentists. There is a great dental benefit in many special needs plans. Talk to pharmacists. They all know people without insurance, as well as doctors. They probably have patients who need an insurance plan and or an agent. So network with your providers. Community meetings and educational events are a great way to see a lot of people all at one time. Host free coffee and chat meetings, educational meetings and seminars, great ways to generate business. Utilize your pre-approved marketing materials that are available to you, flyers, mailers, newspaper ads, things like that. We will be discussing grassroots marketing in depth in our webinar series in just a few weeks, so we hope that you plan to attend that webinar as well. At Medicare Advantage Specialist, our specialty is the senior market, and our carrier portfolio is supported by senior products primarily: Medicare Supplement, Medicare Advantage, Final Expense, Whole Life, Term, Universal Life, critical illness, cancer plans, and annuities. We also have a good dental, vision, and hearing plan set up. So several products to round out your portfolio here available through Medicare Advantage Specialist. Here's a brief preview of our Medicare Advantage carrier partners that we currently work with. Our marketing directors are available to share with you in-depth information on these carriers, as well as which of these carriers offer a special needs plan that can be sold year-round. You may notice an X on Cigna HealthSpring. Unfortunately, we received news Friday that Cigna HealthSpring was suspended by CMS. Members of the plan can stay enrolled, but there is currently no marketing of their Medicare Advantage or Part D plans until further notice. So please give us a call if you'd like specific information from the most competitive carriers in your state and county. If you're on the webinar today and are in the state of Georgia, we will be coming your way the first week of March for a face-to-face seminar. We hope you can attend. Watch your email and your mail for more information on that. Here's a brief look at our Medicare supplement carriers that we offer to our agents. Many of these carriers offer an easy electronic application for those of you who like to submit your applications electronically or sell over the phone. Because when it comes to Medicare supplements, stability is extremely important. Make sure that your portfolio is filled with carriers that not only offer competitive premiums, but also offer a stable rate increase history. The key here is stability. If you're interested in rates for a particular carrier for Medicare supplement, please contact us. We'll be glad to share that information with you for your specific market. Now let's talk a little bit about our critical care and ancillary products. I'm going to try my best just to do a brief overview, but all these carriers bring a lot to the table with indemnity products. So I will try to make it brief. First up is Aetna. Aetna has a great lump sum product as well as their hospital indemnity and newly released short-term care product. Aetna truly is a carrier that has something for everyone. Kemper offers a home health care product that comes with a $250 annual prescription drug benefit. This is a great alternative for your clients who either cannot afford or were declined for long-term care coverage. Speaking of long-term care, between Genworth, Mutual of Omaha, and Transamerica, you have 3 carriers here that offer long-term care policies. So let's jump into GTL and Medico. Both offer a very competitive hospital indemnity plan. GTL, their cancer and their recovery cash are definitely worth taking a look at for sure. Mutual of Omaha has probably one of the best lump sum cancer policies I've seen in a long time. They have options that are more flexible, such as term and permanent coverage, as well as multiple riders. Seriously, some of the best rates I've seen for a cancer policy, so take a look at some of these carriers when you have some extra time. Here's an overview of some of our final expense carriers that we're partnered with. This webinar was, of course, designed to be a very brief overview, but very quickly I would like to focus on just a few of these carriers and what makes them unique. First up is American Continental, otherwise known as Aetna. What makes Aetna very unique is they issue their final expense policies up to age 89, where most carriers stop at age 85. Another on the list is Foresters. They are a fraternal organization and are able to offer their members extra benefits that traditional life insurance companies do not offer. Mutual of Omaha offers an easy tiered application, do not require a phone interview, and also have an amazing children's whole life policy available. Kemper and Great Western are two of our guaranteed issue carriers. Transamerica offers an easy tiered application as well, an e-app, liberal underwriting with a high compensation plan. You have Standard Life and Casualty, hands down, offer the lowest rates for final expense in the industry, so please keep them in mind. And if you want any additional information about any of these carriers, please reach out to us. We'll be happy to assist you with that as well. Here at Medicare Advantage Specialists, we're very proud of the superior service, support, and training we provide to our agents across the country. We take great pride in our relationships with our agents and the carriers we work with. Our staff here provides marketing strategies and assistance, creating numerous opportunities for the agents through lead programs, our agency builder program, fast start bonuses, and other incentives that we offer. Medicare Advantage Specialist marketing managers are eager to work with producers to help you grow your business. We can provide a marketing analysis of products available in your area to help assist you in developing a strategic marketing plan for your business. We're always up to date on the latest products, carriers, lead programs, and services as they become available. And of course, we're always available to provide field support, marketing supplies, certification information, carrier appointments, and service issues. Our goal is to help you grow your business because, let's be honest, everyone here is working and building their own business. For our agents interested in building an agency, as I mentioned, we have an agency builder program which is designed to help an agent do just that. Build an agency. We will run our auto dialer to call agent recruitment lists. The auto dialer will give the agents answering the call an option to press 1 to speak with a live rep. They press 1, the call will be connected to the agent trying to build the agency. Give them the opportunity to recruit the agent on the phone. If they do not answer, a voicemail will be left of a recording that the recruiting agent records, or we can record one for you. We also lower lead costs by splitting the lead cost in thirds. If you work with an agency, Medicare Advantage Specialists will pay a third. Your upline agency can pay a third, and you as the agent, of course, will pay a third. If you are a direct to Medicare Advantage Specialist agent, we will split that up 50-50 with you. It comes out to about $230 per 1,000 pieces of mail. So definitely, something to think about if you're interested in building an agency for yourself. Our agents have enjoyed tremendous success with our lead programs, as well as our incentive programs. We offer a lead program to agents who are new to Medicare Advantage Specialists, as well as agents who are consistently writing business through our organization. Our Fast Start program has been a huge success as well. Who wouldn't love to get extra money in the mail just for writing your first piece of business? And I'm not talking about commission dollars. This is direct from Medicare Advantage Specialists. Obviously, that does not apply to Medicare Advantage products, but as far as the other products, we want to give you an extra little incentive to write that first piece of business. If you'd like more information, contact our marketing team today. We'd be happy to answer any questions you have. We also offer a very competitive prescription drug card program to our agents through RX New Benefits. With this program, you'll be able to add value for your existing clients with an average savings of 30%. However, I have seen savings up to 80%. These discounts are available for dental, vision and hearing, and even vitamins. A lot of our agents have had success using this card as a door opener for prospecting, as well as earning referrals. So keep those ideas in mind as well. You're probably thinking, why choose Medicare Advantage Specialist? Because we're here to serve you. We see we understand that our long-term success will define itself based on your success. So, Medicare Advantage Specialist is committed to exceeding our clients' expectations in every interaction and helping you achieve that same level of service with your clients. Our agent support is our primary goal. We provide every tool we can to assist you in your efforts to identify, inform, close, and follow your sales process. In more practical terms, our marketing team works arm in arm with you to deliver print media, internet, direct mail, and other marketing tools, keeping your pipeline moving. We have one of the most experienced support teams in our industry. And with that said, we have reached the end of the presentation. I'm going to pass it back over to Shanna. I think she has a few more things to say, and then we'll answer any questions.
Thank you, Matt, so much. That was a great presentation, and I know that was a lot of information in just a short amount of time. So over the next several weeks, you can see here that we've got several more webinars set up that we will talk about, the cross-selling opportunities with indemnity plans. We'll have special guest Alan Polly here with us to talk about selling final expense. Andy Watkins will be doing a presentation on building sales with Medicare Supplement. As Matt mentioned earlier, we're going to be talking in depth about grassroots marketing. I think this is a great one that everybody should really try to participate in on February the 23rd. And then on March 1st, we're going to have an exclusive opportunity that we're going to roll out to agents who are contracted and appointed through Medicare Advantage specialists. So we've got a lot going on this month and into February and March. And like Matt said, we will also we're putting our calendar together and we're going to be hitting the road. So hopefully we'll be coming to a city near you. We're going to start in the first week of March in Georgia, in the Atlanta and the Macon market, and then we're going to move on from there. So I don't see any questions in the chat bar. So with that, I'm going to give you back the rest of your day, and I'm just going to leave you with this one little quote. The reason so few people are successful is that no one has yet found a way for someone to sit down and slide uphill. So just think about that. I know that you're going to have questions, and when those questions come up, please be sure to give us a call. As you can see here, our number is 1-800-480-9857. Our website is www.medadvspc.com. This presentation, as well as all of the remaining webinars, will be recorded or are being recorded, and those will be placed on our website. If you visit the website at www.medadvspc.com and then look for the MASTV tab on the website, you will see a library there full of presentations. So if you don't want to wait for one of the upcoming webinars that will be coming up in the next few weeks, we've got one scheduled every Tuesday, then you can look back and see what's already in that library. There's a lot of great information on cross-selling opportunities and a lot about what we'll be talking about in the next few weeks. So again, I want to thank you for taking time out of your schedule to be with us. We appreciate your time. We appreciate your business. We appreciate any questions that we could answer for you, and we appreciate being able to support our agents in the field. So again, thanks so much, and everybody make it a great day.